Hi, I'm Suzanne, and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. This portion of this video is to help you get prepared for your LiteLift. And the information that I'm going to be going over with you in the next few minutes are for those of you that are having a LiteLift in the office with oral sedation. Oral sedation means that you're going to take a little pill, we call it the happy pill, and with a local anesthesia. So it's really important that you're listening to the proper instructions for those of you that are having oral sedation with your LiteLift. In your packet, hopefully all of you have received a packet, there's a sheet. And in that sheet, there's a nice little chart that goes over specifically what to do 2 weeks before your surgery, 1 week before your surgery, 3 days, 2 days, the night before, and the actual day of your surgery. I'm going to briefly go over those instructions to help clarify any questions that you may have. So let's start with the 2 weeks prior to surgery. In this time, you will be having your pre-op, and the pre-op is the appointment that you have with the nurse in the office. Those instructions, we're going to go over some really important points. One very important factor at this point of your surgery is to make sure that you're off all medications that stop bleeding. That would include aspirin, Motrin, ibuprofen, vitamin E, flaxseed oil, fish oils. In your packet, there's a list of medications that talk about all those medications that you could be, or supplements that take that promote bleeding. So if you have any question about this, please call the office and someone will be happy to answer this question for you. So 2 weeks prior to surgery, you need to stop all those medications. Another important factor is, especially with a LiteLift, is that we have your blood pressure under control. At this point, you will have had your blood pressure taken during your consultation with your consultant, and you will know specifically what your blood pressure is. And it's really important that you maintain and keep track of your blood pressure if your blood pressure is a little high during this time before surgery. Let's move down to the week before surgery. During this time, it's really important that you get all your prescriptions filled, and the nurse will go over all the prescriptions that you need to fill. You need to have a caretaker take care of you. Someone needs to take you to surgery, someone needs to bring you home from surgery, and someone needs to stay with you for 24 hours. Even though you're not having general anesthesia, the medication that we give you makes you have kind of silly and not remember things. So it's important that you have a responsible adult over the age of 18 that stays with you. So we ask that during this week before surgery that you have all the loose ends tied up. So that's having your medications filled, having any lab results that may be requested. At this time, we ask that you start washing your face with antibacterial soap. You don't have to wash your hair, but we want you to wash your face every night. And it's real important that you clean all around up here in the scalp line, around your ears and behind your ears. And then 24 hours before your surgery, we want you to not put any lotions or any creams in these areas, because we want the areas all nice and clean before your surgery. On that sheet that I was talking about that talks about what to do before surgery, there's the 2 days prior to surgery. This is a really important point for all of you who are having a LiteLift in our office. That 2 days prior to surgery is when you put the clonidine patch on your chest. And typically we have you put it either over here to the side or over to this side, and you can put it off to the side so it's covered with your clothes. That patch is going to stay on 2 days before surgery and leave it on till 5 days after your surgery. What this patch does is it helps maintain your blood pressure within a normal range. A lot of times when you come in for a consultation or when you're getting ready for surgery, your blood pressure gets a little bit elevated, and this patch just helps keep it where it normally should be. To 1 day before surgery. This is the day that you're going to make sure everything is done. All your supplies are purchased and bought. Make sure you have enough proper food to eat. You want to make sure you have like soft foods, maybe some shakes and some scrambled eggs and things that are going to be easy to eat after surgery. You're also going to, at nighttime, take that scopolamine patch, and that's going to be the smaller of the two patches that you get in your prescriptions, and that's going to go over here on your shoulder, on the outer part. That patch is going to go on the night before your surgery, and you're going to leave that on for 3 days. That patch actually helps with nausea. You can shower with both of the patches, with the clonidine patch and with the scopolamine patch. It's okay to shower, but it's very important when you take those patches off that you wash your hands. If you don't wash your hands, that medicine remains on your fingers, and if you go to rub your eyes, you could have blurry vision for up to 24 hours. You're going to wake up in the morning and have a little snack and something to eat. And at that time, you're going to gather all your medications that you got at your pre-op. And that would be your antibiotic, which is typically Duracef. You're going to have your Zofran, you're going to have a pain pill, and any other medications that we have prescribed for you. Gather them in a bag, and you can bring a scarf with you if you'd like to help cover up the wrap that you're going to have around your head, and come to the office. And you're going to show up an hour before your surgery time. And at that time, the nurse will give you the rest of your medications and let you get sleepy and get ready for your light lift.